We've got about 100,000 people who have got atrial fibrillation. We have only diagnosed about 90,000 of those people, so we have a number of people left to find.
We have some of the highest levels of vascular disease in the United Kingdom, so unfortunately people in this region are much more likely to have a stroke than in the UK as a whole.
Stroke affects every single part of your life, your family, your children, work.
So AF's the commonest arrhythmia that anyone suffers from, and there's a 1 in 4 risk that any of us will develop atrial fibrillation in our lifetime. It is a disease of the ageing heart, so you're more likely to develop it as you get older. But instead of a regular heart rhythm, we get an irregular heart rhythm, which means that clot and thrombus collects in the left atrium, which is one of the chambers of the heart, and when that happens, there's a risk of tiny blood clots being thrown through the circulation, and if they head up towards the brain into the middle cerebral artery that supplies the main hemispheres of the brain, it's very possible that these big clots can block off areas of blood supply and cause stroke, and that's called an ischemic stroke or an AF stroke.
We want to support our region in 3 crucial areas around the identification and management of atrial fibrillation. So the first one of these is detect. We want to find the missing thousands in our region. Within our detect programme, we've got a number of different activities going on. So one thing that we do know is we're only a small team. We can't get out to everywhere in the region, and we can't test everywhere in the region that we'd like to. So we have to work through colleagues, partner organisations and volunteers to help us do that.
The NHS Innovation Agency, North West Coast, has provided us with a very basic ECG device which our staff have been trained to use by a Halton CCG. It's a stick which you hold on either end, and within about a minute and a half it gives a reading as to whether you have an atrial fibrillation issue or not, as the case may be.
Well, I volunteer now at the Brain Charity in Liverpool, and the services manager asked me would I be interested in doing this, and straight away I said, yeah, if I can prevent one person from having a stroke, I'm going to do it.
We also need to make sure that we protect them. So once we've got them into primary care or their GP practice or under the care of a health professional, we want to make sure that they are able to have the right treatment for them to be able to manage their condition in the optimal way.
We know also when people are being treated for atrial fibrillation, they're often inadequately treated on drugs that maybe aren't doing the job, either inadequate dosing or the wrong type of medication.
A lot of the work I've been doing over the past few years has involved personalisation of warfarin treatment, and so our work has involved identifying factors, including genetic factors, that are associated with the dose that a patient might require.
And also we want to make sure that those people who are receiving treatment are regularly monitored and managed, and that's the correct part of the programme. So we refer to it as detect, protect and correct.
We know that 1 in 3 people, when they're given medication when they leave hospital, they stop taking it within 3 months. So there's no point having a tablet if it stays in your kitchen cupboard. So it's about adherence and persistence with medication to make sure that people get benefit.
If, as a region, we improve both our management of atrial fibrillation and improve our detection of atrial fibrillation, we can significantly reduce the number of very severe strokes that I see on our stroke unit every day, and therefore we can hopefully save lives from that, and we can also reduce the amount of people who have very severe disabilities from their stroke as a result.
We think that we can save a stroke a day. We're working with multiple partners, we've got people going out testing each day across our region, and we fully expect to have reduced the number of strokes to less than 500 in our region by 2020.